The LAN 4000 software can be configured however it needs to be to accommodate the wide variety of medical specialty offices who use our product. In this example, it's labeled for a 2-doctor optometry practice with 5 exam rooms. Either doctor can be in any one of the 5 rooms. So we've given each doctor their own color palette, and each button is labeled to mean different things. For example, the PAT light means that there's a patient ready to be taken to the back. The tech light will light up when the doctor needs to page a tech. The doctor will light the OPT light when they need to page optical. For dilations, you simply click on the dilate button, set your timer, you can type in the patient name, and when you hit OK, it starts timing down from 20 minutes. When it gets to 0, that light will go from solid to flashing, and there's a unique sounding chime for the dilation timer. The last timer on this column is for the doctor to time themselves for their portion of the exam. Most doctors are trying to get their part of the exam done in optometry offices in about 20 minutes. So they now have a running total to remind them how far along they are during each exam. We have something called patient sequencing we use, and when the first patient is put in a room for a doctor, it will flash automatically. As subsequent rooms are filled with patients that are ready for the doctor, they will light up solid, so that each doctor has a visual representation of how backed up they're getting. In this case, the red doctor is in exam room 2 because it's flashing. The staff knows the doctor is in that room or on his way there, and he also has patients waiting in rooms 4 and 5 and another one up front, so he needs to get on with it here. As he finishes up, he can light the red light for optical and page them to exam room 2. In the green doctor's column, he just clicked on the tech light, paging a tech to room 1. The buttons to the right are timers that have been set up for the techs to time themselves for a full workup, so that they can be looked at a future time and compare them to each other and to themselves to see if everyone is meeting their goals or if additional training is necessary. Comlite also has text capabilities. You simply click on the text button and it opens our text interface. The top panel shows incoming messages with the time it was sent, the name of the station that sent it, and the message itself. The bottom panel shows your outgoing messages. To send a message, you can use from presets that you use all the time. Simply click drop-down window, pick where you want it to go, and hit send. To type a custom message, simply start typing in the field at the bottom and choose where you would like it to be sent. The administrative station for Comlite is where all the setup is done, and setup will determine the name of each station, how you want it to respond on your own personal desktop. You can decide how many buttons you need depending on the size of your office and your staff. Sequencing is to choose the different sequences for the various doctors in the office, and we have up to 5 different sequences. And there are different chime types for different job functions or people within the office. This is also where you will select your up timers and your down timers. The button tab is used to label the various lights, and there's a hint field you can fill in as well that explains what the button means when it lights up. Overall, we try and give you a visual snapshot of what's going on throughout the office at any given time to reduce patient waiting times. It helps staff know what rooms are available and where each doctor is, and the doctors can page tech and or optical or other staff members back to their room, allowing the practice to revolve around the doctor's activity and maximizing their exam time.